someone have both complex post-traumatic stress disorder and borderline personality disorder? I'm a clinical psychologist, and yes, this is possible, but let's break it down. Complex post-traumatic stress disorder is diagnosed in the ICD-10 or 11, but not in the DSM-5 yet. This is the Diagnostic and Statistical Manual of Mental Health Disorders that we commonly use in Australia, but unfortunately, complex PTSD is not in there as a diagnosis. Now, the reason someone can have both is because many people with borderline personality disorder, which is a turbulent and complex personality disorder, often emerging in adulthood or late adolescence, takes time to develop. Whereas complex PTSD, remember the C, it usually starts in childhood, and it is the repeated exposure to traumatic events such as neglect, abuse, or captivity. Now, the main difference is people with complex PTSD may not necessarily have difficulties with impulsivity or a fear of abandonment. And people with borderline personality disorder may not have flashbacks or nightmares like the person in complex post-traumatic stress disorder. Now, the reason they can look similar is both of these disorders may struggle with their sense of self or self-concept. A 2022 meta-analysis found that 23.5% of people with borderline personality disorder also met the criteria for post-traumatic stress disorder, and even more people for complex trauma, which shows there is a very strong link. The main difference is BPD is a personality disorder that is often rooted in attachment and emotion dysregulation. So usually as a child, your core emotional needs did not get met, which disrupted your attachment, and these attachment disruptions play out in your adulthood, which lead to interpersonal difficulties. Complex PTSD is a trauma-related disorder stemming from prolonged exposure to traumatic incidences. And yes, both of these can be true at the same time. They require intense therapy. Usually with borderline, it is dialectical behavior therapy and help with emotion regulation. And for complex PTSD, it is trauma-informed therapy. But the most important thing is that you're consistent no matter what therapy you do. Got a question on psychology? Let me know in the comments.